here at Merriweather Surf House to co-host the 2022 Commissioning Innovation Showcase. Just about ready to kick off for 2 days of a really innovative program that concentrates on value, digital health innovation, integration and engagement.
We're delighted to be facilitating the fourth National Commissioning Showcase. The theme for the 2 days is really driving sustainable change. The showcase has been designed by PHNs for PHNs. So we've undertaken a pulse survey just to really understand what PHNs wanted to talk about and what people wanted to hear at this event.
We have 120 people that will be here today in total from 22 PHNs, with 16 PHNs represented on the verbal presentations and another approximately 10 presenting posters.
So commissioning in Australia is actually very new. It started with PHNs in 2015. It's been a journey for us. What we've wanted to do is try to share that journey for PHNs. The idea of the showcase is for PHNs to be able to share and celebrate their successes, share the things that haven't worked so well, and really learn from each other. And we found that incredibly beneficial.
When the showcase started, PHNs were learning about commissioning, and we were focused on short-term commissioning with service providers that we knew. We're now in an environment where we're going to be doing some of that co-commissioning with other funders and other stakeholders like LHDs. And for me, as we move towards value-based commissioning, it's an opportunity for us to learn across the sector.
It's been really great to hear from our keynote speakers this morning, setting the scene and the tone for day one. We've also been able to hear about some additional projects that are being done in the shared care space. So yeah, some really interesting and innovative things are happening.
I'm really keen to hear about the different value of healthcare, so what other PHNs are doing to make sure that what we do is meaningful and measuring our outcomes. I'm keen to hear about integration and how we can work together with our acute care sector as well as PHNs and how we can work together to get better health outcomes for our population.
Today I'm going to be talking about some of the challenges that PHNs face, partly because of the difference between the aspirations that are set for us and the money we've got, but also some of the potential futures for PHNs. And so, for example, is there more that PHNs can do and what might that more be?
I'm talking about value-based healthcare, which is a focus on health outcomes and making sure that we collect data to improve the service that we provide for our patients. I'd really like the attendees today to take away 2 or 3 actions that they can implement in their practices or at a PHN level to improve population health, research and evaluation, and to really focus on health outcomes.
So we're really pleased today to be able to be talking about the work that we're doing around service price benchmarking, which is going to take us further on our quest towards value-based commissioning. So really trying to understand the price that we're paying. Are we paying a fair price for services, and are we getting best value for money for the community with the services that we're commissioning?
We're here to be able to share our commissioning experience with regards to assisting PHNs in the technology space. And it's just wonderful to see PHNs partnering to bring together a really great showcase to be able to talk about some of the common challenges amongst PHNs, particularly given the last couple of years, but also some of the opportunities and some of the solutions and the way some of these problems have been solved. And PHNs are really at the forefront of this in our health sector and in our community. So really enjoying the conference so far, and really would recommend it to anyone that's working in the commissioning space in the health sector.
I love the idea of the PHNs getting together to understand how to best undertake commissioning in Australia. We need to reorient the healthcare system towards outcomes. There's a lot of activity. 99% of our health system funding is based on volume rather than value. And I think there's a huge opportunity to put more resources into primary care and also into preventative health, more proactive management of chronic disease.
So I really enjoy gathering with other PHN team members. I like to hear about all the various programs that are going on across the country. It's really great to hear about the different initiatives that are going on so that we can share ideas rather than trying to reinvent the wheel.
Quite shamelessly, I'm here to steal ideas, to actually learn from everybody else, and actually, you know, this is what they do in this particular PHN. How do we change that? How do we adapt it so it works for us? And the way the conference is structured gives us immense opportunities to do that.
I think it's a really good opportunity for PHNs to come together, share ideas, share experiences, and hopefully we can go away with some vigour and some new concepts under our belts to look at commissioning a little bit differently.